Okay, good morning and good afternoon. This is Dr. Akilu from Armauer Hansen Research Institute, and I'm truly honored that my abstract is accepted, and I'm excited for the opportunity to share Armauer Hansen Research Institute experience and lesson with the international audience at Evidence 2025, and I look forward to engage in discussion with the fellow colleagues. And I'm sharing this as a pre-recorded video for the audience. So my presentation is mainly focusing on Armauer Hansen Research Institute experience on evidence-informed decision-making for biomedical and clinical research, and Armauer Hansen Research Institute's experience and the way forward. I am a director at Armauer Hansen Research Institute for Knowledge Management Directorate, and Armauer Hansen Research Institute, which is found in Addis Ababa, Ethiopia, and it is a dedicated medical and clinical research institute. So in the background, in Ethiopia, there is a challenge in translating scientific evidence into policy, program, and practice, remaining a challenge due to different reasons. Among these challenges, there are fragmented evidences and channels, and there is also lack of high quality evidence and low uptake of evidence. So to address this challenge, the Armauer Hansen Research Institute aims to enhance the culture of evidence-informed decision-making by engaging key stakeholders from different sectors. So the objective of this abstract and experience sharing document is to foster evidence-informed decision-making by multi-sectoral collaboration in Ethiopia. And method, Armauer Hansen Research Institute conducted series of consultative meetings from December 2022 to May 2025 with the Federal Ministry of Health, federal agencies, Regional Health Bureau, Regional Public Health Institute, and the partner from higher education institutes, including universities and donors and funders, and member of parliament and the media representative to identify barriers and opportunity for evidence-informed decision-making throughout the country. So with this, we identify different challenges and different issues raised by the partners and stakeholders, and we provide the capacity building training workshop for academic and researchers, media professionals focusing on evidence synthesis, knowledge translation, and science communication, especially for media professionals. And then the result, over the past 3 years, we engaged different partners from different institutes, and from the key stakeholders, we engaged nearly 700 participants and from 89 organizations. Following the consultative meeting, there are feedbacks and there are outputs from each key stakeholders. The first output and we get from member of parliament, they were supportive on involving and problem solving the institute bottlenecks which has been faced in the different sectors. Especially we are working research and we are conducting studies throughout the country, and we have been facing different challenges. For example, we have procured equipment from foreign countries, and there are different challenges. Among these is the foreign currencies, a big challenge, which is what we are working with the bank sector. And after we procure the reagents and equipment from foreign, there is also challenging custom clearance, and including the procurement of reagent related goods. So the member of parliament were engaged in problem solving challenge that AHRI has been facing. In addition, also we call key stakeholders from region, from public health institute, from regional public health institutes who are dedicated and mandated to conduct the study in the regional health priorities. There are also universities throughout the country. We have 54 public universities throughout the Ethiopia, and there are different actors in the region and in the central part of the Ethiopia. So by calling and engaging these five, we established the 5 research consortia, health research consortia throughout the country. It is mentioned that we established the Northern Ethiopia Health Research Consortium. It includes different higher education which are found in the Northern Ethiopia. We established Central Ethiopia Health Research Consortium in Addis. It is based in Addis. and we established the Southwest Health Research Consortium. We established Southwest Ethiopian Health Research Consortium, which are mainly focusing and working on the health challenges and priorities. So AHRI has also mandate to conduct a study on the regional priorities. With this aim, we sit together and we call different engagement meetings to identify the regional health challenge, which has been responded and supported by the research and scientific findings. Within this collaboration, we identify his research priorities for the 3 consortia. So we are working on identifying the research priority. Depending on this research priority, the university staff, especially the academic staff and the postgraduate and students are planning to have been conducting a study on identified health challenges and the problems. So that will bring the tailored solution for that region, tailored solution for the country, depending on the evidence that the student and the research academia conducted the study. With this, we have been working with the 5 health research consortiums throughout the country. On another side, also we provide training for media partners. So those media partners are journalists, and they are not most of them are not familiar with the scientific results, scientific outputs. So we provide how to communicate the science to the scientific output for the community. We provide consecutive 3 rounds training for the media partner. So we get good feedback from the media partners, and they have good understanding on science communication. Another is also, as we have been working the research and conducting the study, and we are expected to provide evidences to support health system, especially we are under Ministry of Health Ethiopia. So we have been providing policy briefs, issue briefs, and other scientific output. But the output, the uptake, the result uptake is low, the evidence uptake is low. So we conduct consecutive engagement with the Ministry of Health to increase the uptake of evidence. So the ministry established a new office, which is called Policy Strategy and Research Executive Office, which is mainly working on connecting the scientific output with the program leaders. With this, we have been, as Armauer Hansen Research Institute, closely working with Ministry of Health, and there is a good feedback, getting feedback, and there are mechanisms to get feedback, and there is also a point to get a focal point to communicate the scientific output. There are impacts after this office establishment. There's a better communication platform from which our research output get attention, and our researchers are motivated to conduct impactful studies, and the institute annual publication has been increased by 35% compared with last 5 years, and the average, especially the average impact factor for our publication is increased from 2.2 to 5.5, and this is a great achievement for us to communicate and to disseminate and to support the evidence-informed decision making throughout the country. In conclusion, this is very important. There are a challenge already we have identified, we have discussed, we have established the consortia that the stakeholders, the key stakeholders are closely working with Armauer Hansen Research Institute. Our researchers are motivated to conduct impactful study. Our publications impact is increased from time to time, including the grants, and the international acceptance is increasing. So in the conclusion, it is good to enhance and strengthen evidence-informed decision making in Ethiopia. Demands a muti-sectoral collaboration that brings the scientific evidence and health policy, practice, and strategy. So our experience showed that the value of partnership, collaboration to collaborative strategy, and need-based training in advancing evidence-informed decision making for key stakeholders, including the media, postgraduate student, and the academia. This is a great. Also, we have a recommendation. So, establishing engagement meetings and consortium significant enhance knowledge transfer and strengthens the partnership. It's created a valuable platform to bridge it together and engage all community. There are different communities, community in academia, community in policy, community in research, in single space for dialogue and collaboration. Therefore, our next step is we will strengthen our health research partnership with the key stakeholders, as I mentioned during my previous discussion, and conduct studies addressing the identified key research priorities. So we will create opportunity for, especially, and we are working on mentorship, early career researchers to work closely with AHRI scientists, including fostering the mentorship and skill development. So AHRI has the good state-of-art laboratory facilities, and there are high calibrated researchers and scientists in the institute. In addition, we will provide need-based training for the university staff, for the media, and for our key stakeholders on evidence synthesis. Finalizing the result, also we have left with two regions, two consortia to identify the research priorities and finalize the result on the regional health priorities and assess the impact of both training and collaborative effort. Thank you so much for your attention. This is all I have for this conference. Thank you so much. Thank you for the opportunity.